All right. Good morning, everyone. Are we all ready to go? Everyone's ready? Okay. Joining us today to discuss the future of long-term care in Saskatchewan, we have Minister of Seniors Everett Hindley, SHA CEO Scott Livingstone, and joining us via the web, we have SHA's Sharon Garrett, who is the Vice President of Integrated Urban Health and the Chief Nursing Officer. We'll begin this morning with opening remarks from Minister Henley and Scott, followed by questions from the media, and one follow-up. If anyone has following questions, we can kind of swing back here, but we'll go with that. And with that, Scott, would you like to begin?
Sure. Thanks, Carly. Good morning, everyone. Before I begin, I'd like to express my condolences to the families of those who've passed away from COVID recently and those who continue to struggle in our ICU and our hospitals. Given that most of the demand is from the unvaccinated, this should underline the importance of vaccines in helping keep people healthy and protecting the health system capacity. So please get vaccinated. I'd also like to thank our healthcare teams who are going above and beyond during these unprecedented demands right now on the system. Today, however, I'm going to focus on the future of long-term care homes operated by Extendicare in Saskatchewan. As you're aware, the 5 Extendicare homes in Saskatchewan have been under Saskatchewan Health Authority oversight through a co-management agreement since August 5, 2021. At this time, Ministers of Health directed SHA to take control of clinical services at these homes and review their operations. This direction was given after consideration of contents of the ombudsman report into the COVID-19 outbreak at Extendicare Parkside in Regina. Sadly, as you know, 42 individuals died during that outbreak. And I've said it before, but I'll say it again. I wish to extend my deepest apologies to the friends and families of those who passed away during this outbreak. I apologize for not being able to do more to prevent such a tragic situation. We hope we can honor their memory by moving down a path that helps us strengthen the services and supports for people in need of long-term care in Saskatchewan. Today, the Saskatchewan Health Authority is announcing, with Extendicare support and cooperation, that we will be working together to transition the delivery of long-term care services provided by Extendicare in Saskatchewan to the Saskatchewan Health Authority. We've worked closely with Extendicare throughout this process and appreciate the cooperation that we've received during the outbreak at Parkside and throughout the course of our recent co-management agreement. At the center of this transition will be our commitment to the safety and quality of life for the residents of these homes. We know from talking to Extendicare they share our desire for a seamless transition process that puts patient safety and needs first. I should emphasize that over the past few months, Extendicare's teams across Saskatchewan have worked closely with SHA, and together we've demonstrated strong collaboration and cooperation. Furthermore, this decision is not a reflection of the dedicated and professional care staff at these facilities have provided over the months and years to residents that they serve. There is no single factor to cite this decision. In this instance, there were multiple review processes at play, including the ombudsman report and multiple layers of analysis. And while our assessments did show more issues at one of the Extendicare homes than others, our overall decision was informed by many other factors. We took into account the many lessons we've learned during the pandemic, the ongoing increases in demand for long-term care services, and the increasingly complex needs of the older age groups served in long-term care homes in Saskatchewan. Moving forward, the SHA will continue to cooperate with Extendicare to determine the process and timeline for completing this transition. The process will take many months. A timeline will only be finalized once the SHA and Extendicare have developed a transition plan together. For this reason, the co-management agreement has been extended indefinitely earlier this month. This will enable the SHA and Extendicare to put in place the necessary transition processes and timelines to ensure stability and continuity of care. We will take a methodical, safe, and coordinated approach to the transfer of these services. While we will continue working with Extendicare on ongoing continuous improvements, residents will continue their routines, receiving care, and the services that they currently receive. The SHA will share any changes or longer-term plans with residents, family, and staff prior to those changes taking place. Let me finish by saying the SHA is grateful to Extendicare staff for their ongoing commitment to the residents of these homes. We recognize that the heart of this story publicly was a tragedy. But we also know that Extendicare staff have built many strong relationships with their residents and families over decades. We're grateful for their ongoing service, for their patience with us, and their work as we continue to collaborate on this process. Similarly, for the residents and families, we are appreciative in advance for your patience during this transition, and we will work to improve services and the supports that you rely on. Thank you.
Thank you, Scott. And next we have Minister Henley.
Thanks, Carly, and thank you, Scott. As Scott has described, the SHA has decided to initiate a process to end its relationship with Extendicare. The government and I, as minister, support this plan. Our goal as government is always to ensure our residents of long-term care receive high-quality, safe care and services. And I'm confident that during this transition, the SHA and Extendicare will continue to prioritize the safety and well-being of its residents. While the SHA and Extendicare determine the process and timeline for Extendicare to transition its Saskatchewan homes to the SHA will continue to co-manage the 5 Extendicare homes in Saskatchewan. So let me extend my appreciation to the SHA and its staff for their efforts as administrator for the Extendicare facilities, their commitments to high-quality care for residents, and their support for residents' families. I also want to thank the staff of Extendicare's facilities for their continuing commitment, compassion, and dedication as they serve residents across the province. As you know, at our request, the SHA submitted a report to the government concerning Extendicare homes in Saskatchewan. At this time, we are providing a high-level summary of the report. You'll have copies along with the news release, and it will also be posted to the government website. As Scott has indicated, there was no single deciding factor for this decision. This report, along with the ombudsman's report, were just 2 of many factors considered in the SHA's analysis. Before I conclude my remarks, as I have done before, I would like to again take this opportunity to apologize and extend my sincere condolences to the residents who contracted COVID-19 and the families of residents who passed away during the outbreak. I am sorry that the measures and supports in place were not sufficient to prevent this tragedy, and our government is committed to ensuring the necessary changes are made to prevent similar situations from occurring in the future. And with that, Scott, Sharon, and I would be happy to take any questions you might have.
Thank you, Minister. We'll now open the room for questions. I'll go just kind of around the table here. Arthur, if you'd like to start.
I have to vote, sir. I just have to
No.
file something and then.
Okay, Lisa? So you said that there wasn't any one thing that precipitated this decision, but maybe you could go through and give us some of the other things that went into this.
Sure, I'll maybe start and then Scott can jump in, or Sharon perhaps with some additional details. You know, there were, if you go back in this, you know, we, as early as last winter, I wrote to the ombudsman asking for her office to conduct an investigation and did a very thorough job and presented that report to us as government in the summer, and provided us some recommendations to Extendicare and to the SHA. And at that time, you know, we made a decision to appoint the SHA as an administrator over the Extendicare homes, the 5 in Saskatchewan. You know, and then since that time, you know, the SHA has conducted their own analysis, and that's what we're here talking a bit about today in conjunction with this decision. But that there was some variation between you know, between the homes with regard to pandemic planning and readiness. There were some gaps there that were identified, but surely, and of course, the tragedy that occurred at Parkside was one of the major factors in the decision, but there were other ones involved as well in the SHA's decision, and the government supports the decision that's been made by the SHA. And Scott, I don't know if you wanted to add any further information in terms of details around the decision-making process and the factors that were involved.
Sure. And I'll start as I did in my speaking notes, and then I'll ask Sharon to add any more details to your question. But I want to take this back to the very start of this, you know, the incident that occurred at the outbreak and some of the things that we learned very early on. And this was public information because I've been interviewed on this before. So if you go back, we'll talk about some of the things we found when we went into the home. But in particular, it was, you know, given the high rates of infection in the facility, there was concerns around infection control practices being followed with respect to the COVID protocols that we had released across the province that resulted in, we believe, in a higher infection rate. That stimulated other interests across not just that facility, but what was going on across the other Extendicares. And I can tell you that, subsequent discussions and review over the upcoming months did not highlight any, more significant things occurring at other facilities, but there were some other challenges. So that, as you know, stimulated both through the direction of, or the request of the Minister to the Ombudsman report. We've also, through the Ombudsman report, the recommendation of a critical incident review and ongoing co-management discussions with Extendicare. Those things brought together were really the factors that led to this ultimate decision. And Sharon, did you have anything else that you'd like to add?
No, I think we've had a lot of learning through the pandemic about what needs to be in place in long-term care and what the needs are across facilities. We've co-managed with Extendicare at Parkside earlier on during the pandemic, and then at Minister's direction took over co-management of all 5 sites. So our observation and experience there in conjunction with what we already knew from the Ombudsman's review gave us quite a bit of information about the current state, and we reviewed that in I guess the context of what our long-term care needs are across the province. So it's multifactorial, and lots of information contributed to the decision.
Thank you. Lisa, do you have any follow-up?
When you announced that you were taking over management, you said it was in part to make sure that the recommendations from the Ombudsman were implemented. Now, Extendicare, in their response to the Ombudsman's report, did not specifically say that they were accepting it. They did not specifically say that they were going to implement all of the recommendations. So my question is, how much did Extendicare kind of participate, and how I guess accepting were they of some of the changes you wanted to make and through this process?
So as I highlighted throughout my opening remarks, we have had, I would say, a very strong collaborative relationship with the Extendicare, both the team on the ground and the national team that supports them. Extendicare is a national corporation that has multiple facilities across multiple provinces. Specifically with respect to the recommendations to Extendicare and the Ombudsman report, on behalf, I'm not going to speak on behalf of Extendicare, but we are familiar with the status of where those recommendations are, including the apology that was asked for, that was delivered in August, the critical incident review, which has now been performed, and the 2 middle ones around the IPAC resources, or infection control resources, as well as the compliance with other government and policy standards are pieces of work that are in progress. I would say, Sharon, do you have anything else to add to that?
No, I would just add that the Extendicare staff and leadership has been working very cooperatively with the SHA to follow up on every one of the recommendations. Thank you.
Thank you. Allison?
Yeah, so I guess besides those recommendations, now that management is shifting, how will that change for workers at Extendicare, and also just standard of care for the patients?
I can maybe start, and Scott will probably want to add some things there. I just want to say that nothing will change, in the immediate future for the staff or the residents, and the family should be aware of that. I should point out that families and residents and staff have been notified of the announcement today prior to us starting this press conference, so they're aware of what's occurring. But I would just emphasize that this is going to take place over a period of months. This transition process that Scott will speak to, and how that will occur. Of course, there'll be a number of decisions that'll have to be made as that transition takes place. But the bottom line is, today nothing changes for the residents of these 5 facilities in Saskatchewan. Nothing changes for their families or for their staff.
So I would agree with everything the minister said, and just follow up with a couple of comments specific to the staff. Is, all the staff within the Extendicares remain Extendicare employees. We are following the collective agreement process with their unions very closely, and we'll keep everyone informed, as we have today with their unions and the staff. I want to be clear that we have had a good collaborative relationship with Extendicare and have the same goals. And I would say the success of this transition will be measured by the residents, patients, families, and staff in these facilities. And our hopes are that the transition is as invisible as possible, and what they see is the care that they receive each and every day is high quality and safe, and they see the teams working collaboratively together to ensure that that happens with strong communications across the piece as we transition this work together.
Any follow-up, Allison?
Yeah, the Parkside outbreak brought a lot of criticism just in regards to provincial standard of care regulations. Do you think if stronger regulations were in place, would the outbreak have been as bad? And will this now prompt you to look into stronger regulations?
So we have a number of policies and guidelines that are in place currently that are in place for monitoring standard of care and level of care at any of our healthcare facilities in Saskatchewan. We've heard us talk before about the CEO tours that have taken place around the province and the existing guidelines for special care homes. What's been discussed today, in terms of part of the decision-making process was some of the variation between some of the homes in terms of actually following through and implementing and following the guidelines that are in place. That being said, I mentioned this back earlier this summer that we are working at the government and at the ministry level on a new inspection process for facilities in Saskatchewan. We expect to have more information on that a little bit later this fall. But again, we do have very good standards and very good processes in place currently to ensure that residents of care homes, whether they're in care homes operated by the SHA or by any number of our affiliate partners we have in this province, who are doing very, very good work as well and following all of these guidelines and to make sure that the residents are safe. Scott, any additional comments you may wish to make?
Thanks, Minister. And just to add to that, part of the recommendation the ombudsman did make was highlight some of those areas specific to the outbreak and specific to that facility that we are working through, in particular infection control and following the standards that already exist. So with respect to, the criticism of existing standards relative to this outbreak, we would say, one, this type of outbreak didn't occur in the other 4 of the 5 facilities for Extendicare or to an extent to anywhere else in the province of Saskatchewan. However, that said, to the minister's point, we're always, as part of our accreditation standards as an organization, which include long-term care homes, always striving to improve the quality, safety, and care standards for residents across this province. And part of the work that the teams have been working on the ground collaboratively, both through Extendicare and the SHA, is to implement those at the fullest extent. We know those standards work.
Thank you. Mickey?
Who, I guess, made the decision or presented the idea to end Extendicare's contract in Saskatchewan? Was that the government that kind of provoked that, or was it Extendicare that said they wanted an out?
I don't believe it was either. It was, well, I would say that collaboratively with Extendicare, the SHA, the Saskatchewan Health Authority, did have discussions with Extendicare around some of the work that we were doing together and possibly some of the outcomes, which include this outcome today when the decision was made, and we put forth this recommendation to government to make this change with respect to the operation of the Extendicare facilities in Saskatchewan.
Oh, can I go to my follow-up? I didn't know if anyone else wanted to answer. In terms of Parkside Extendicare, like, the government has known that facility has had issues for like almost a decade. You've mentioned now that, that's been the site of so many outbreaks, not just COVID-19. It's been, I think they had 13 outbreaks in 2020, not just COVID-19. So what's going to happen with that facility? Are we going to keep that open? Is the government looking to close it? Because we know that that facility was the site of poor ventilation and does not have infectious disease control. So what's happening to that facility?
Yeah, sure. So first of all, there's already been many things that have occurred relative to the facility structure itself, including other long-term care homes across this province, SHA owned and affiliate with reviews of ventilation and our overall facilities. We track our overall facilities with respect to infrastructure and improvements that are required on an annual basis. With respect to infection control practices, and their relevance, it wasn't just the facility. If you have infection control policies, it's not the facility that follows them, it's staff and folks inside the facility. So with respect to what happens to the facility, it's too early to say. For one, the facility is owned and operated by Extendicare. It's not owned and operated by the province of Saskatchewan or the Saskatchewan Health Authority. So that's part of what the transition includes. It's not just the care of the residents under the Extendicare umbrella of 5 facilities. It's actually the land, the facilities, and other aspects of their business that will have to be negotiated out of, given the current agreement with Extendicare. Sharon, did you have anything to add to that?
I think it's a really important concept to understand that it isn't the facility that causes outbreaks. It's our interaction within the facility. And we have facilities, similar facilities, that don't have the same experience or haven't had the same experience as Parkside with outbreaks. So our processes look at what the risks are and identify practices that can mitigate the risks of infection control and spread of disease. And it's how we implement those practices on a daily basis that have an impact on outbreaks and others. Facilities are a piece of it, and there are challenges across many facilities, and we look at ways to mitigate the risks, but it's only one piece of it. Thank you.
Are we looking to transfer residents out of that facility at any point?
No. So at this point in time, the residents in these facilities are not being transferred outside of the facilities. As Sharon said, there's many other aspects of care, including many of the things that happened specific to the outbreak management before 2021. But pointing out, for example, there are no 3 and 4 patient rooms anymore provincially, including at that facility, which was one of the areas that was highlighted with respect to contributing to the very, very fast spread of the disease within the facility, as Sharon has said, beyond the facility itself.
If I could just add to that too, Scott's spoken and Sharon have spoken about the continuous improvement that we're trying to make when it comes to long-term care and healthcare in Saskatchewan, and following up on implementing the ombudsman's recommendations of getting away from 3 and 4 bedroom wards. We no longer have those as of the end of March. We've moved away from that, and government continues to try to make improvements across the province. There's demands, and we've talked about in the past about new long-term care facilities in a number of communities across Saskatchewan, and here in the capital city of Regina. Earlier this summer, we announced a 600-bed long-term care bed replacement project, of which 250 of those are specialized beds, and the other 350 long-term care beds will be standard long-term care beds. We know that there's demands across the province, no matter where you look, rural Saskatchewan, northern Saskatchewan. We've committed to a number of other projects, long-term care homes in places like Meadow Lake and Grenfell and La Ronge, and here in Regina. So that's part of our continuous improvement program, and as Scott and Sharon have said, it's part of it. We've invested some money to try and address some of the challenges we have in some of our older buildings, and we try to tackle it as quickly and effectively as we can, but knowing that buildings are one part of it, but the practices that are implemented in these facilities, and we've seen that throughout COVID-19, where Parkside was indeed the most tragic of circumstances that we had there, just the vast number of fatalities that occurred. But there have been other outbreaks in other facilities, and they have been and there have been lives lost, and that is, and I'm not minimizing that either. That every life that is lost as a result of COVID-19 is a tragedy. But we've had effective policies and things in place to make sure that whenever we do have an outbreak, whether it's COVID-19 or anything outside of COVID in our long-term care facilities, that we try to take as many steps as we can to minimize the risk to residents and make sure that we're keeping them safe.
Thank you. Katsia?
Yeah, my question is, the ICU situation right now is very difficult in the province. If another outbreak were to happen in one of these facilities, what is currently in place to manage this outbreak for the seniors in long-term care?
Sorry. So let's talk about, first of all, many of the preventative things that have been put in place to protect residents of long-term care, and in particular, and most important, is vaccination. When we go back through the course of the pandemic with respect to the care of long-term care residents and the hospitalizations, and I will say that one of the things, because your question was specific to ICU capacity and long-term care, is the protection of long-term care residents with the first phase of the double dose of the vaccine worked. We saw, in outbreaks and infections in long-term care literally plummet as soon as we got to the long-term care residents, personal care home residents with the first stage of vaccine. You'll probably, with some of the provincial results reported recently and the boosters that have now been delivered to the long-term care residents because of the waning immunity to COVID, we've also seen, I think about 4 weeks ago, we had a number of infections in long-term care. We're seeing outbreaks still, but outbreaks that are not getting out of control and being managed. We know, how to protect each other from the disease, not just with vaccination, with PPE. But at the same time, I think, again, and I can get you specific numbers, but, 4 weeks ago we had 120 plus infections in long-term care. I think today it's 60. It's a direct relationship to the booster, which doesn't take long to take effect in those long-term care residents. So I would say, beyond that, it's the other work that's been done throughout the pandemic of validating that all of our facilities, affiliates, and the partners we're working with, as we talked to today, are implementing infection control practices as required throughout these facilities. And with respect to, although ICU capacity is at the highest level it's been in ever, with respect to the contribution of long-term care residents. To be honest, many of the long-term care residents that were infected with COVID, including during the outbreaks, weren't hospitalized. These residents were cared for in their home, and many of them, because of where they live and their age, don't want to be hospitalized. So I can say that right now, an outbreak in long-term care is not what scares me with respect to hospitalization or ICUs. It's because that's not who's being hospitalized. It's the unvaccinated, it's the younger individuals across this province, it's individuals who are older but also didn't get the opportunity to be vaccinated, and many individuals still with lots of comorbidities. But we do have many young, healthy individuals who are unvaccinated in this province that are sitting in ICUs today and sitting in our hospitals, and that's our single biggest challenge, and the way out of that is vaccination.
Any follow-up?
Yeah, a follow-up on that, just for ICU situations. Will the SHA be recommending to the government to get more federal help based on the situation where we're at in the province right now?
So depending upon, first of all, this has been kicked around a lot. I know the Minister Merriman was asked this, is why aren't we asking for federal military help? The question I would, that comes to me often is, what does that mean? In the discussions we've had with Alberta and what's going on in Alberta, you're not seeing intensivists and ICU nurses and perfusionists and respiratory therapists dropped into provinces to support from the federal government, because as I understand it, they don't have those types of resources. The types of resources that they have might be nurses that are trained in acute care, not in ICU, that could help spell off some of that stuff. But that's what we're doing now with our service slowdowns, is redeploying our own resources, upskilling nurses, upskilling other staff to support our COVID response. That said, I mean, we are in a situation where we are seeing some of the highest rates of infection and admission to both ICU and hospitalizations. And it's our job to plan for the worst case scenario and what happens if we hit our capacity. And those discussions, as you know, have been occurring with, Ontario with respect to transferring patients out.
Was that a yes or a no to her question? Would you recommend getting federal help? Yes, I'm just not sure if it's a yes or
Personally,
no.
based on what I was told about available federal help for healthcare, and 10 resources going to Alberta, divide that by 4, we would get 2. I'm just not sure that that's the path we should be taking. So no, I wouldn't recommend it. Our recommendation is ensuring that our patients receive the highest level of care they can in province, and our staff and teams are doing their very best to do that today. And if, in fact, we cannot provide that care in province, we believe that sending people out of province so that they can receive that same level of care that we want in our ICUs would be the way to go.
Thank you. Mark, any questions?
I'll probably
Arthur?
Yeah, sure. So you both have been kind of emphasizing the kind of collaborative relationship that you've had with Extendicare and the extent to which that they've cooperated during this process. But I'm just wondering, to what extent, could you just be clear on whether you still have confidence in Extendicare's ability to have operated these facilities safely, and whether that played a role in this decision? You talked about there being many factors, but is that a primary factor, that you no longer have confidence in their ability to safely operate these facilities?
I'll start, and Scott might have some comments. Arthur, I think what we've seen is, as a result of the ombudsman's investigation and the SHA's analysis of since they've taken over and have been co-managing with Extendicare since earlier this summer, and will continue to co-manage throughout the transition process. I think what's been identified is we looked at not just what occurred at Parkside, of course, which again was one of the major factors, but across all 5 Extendicare homes. And again, we have policies in place. We have things that are there in place so that we can ensure that the residents receive the best quality care they possibly can, whether they're in an SHA-run facility or a facility run by an affiliate partner or by a group like Extendicare. But the SHA's analysis of it and what's been released in the executive summary today points to some lack of consistency and ensuring that these policies are followed through on, and some questions there in terms about how it was implemented and what was being done to keep residents safe. So that's why the government supports the SHA's decision to end its contract with Extendicare and find a different way of doing things at these facilities.
Follow-up, Arthur?
Yeah, I do have a follow-up. So it sounds as though this is going to involve, as you said, taking control of the buildings and the land as this process continues, as well as the services. And I'm wondering if we yet have any notion of how much that's going to cost to actually take over all of those facilities and further to potentially break this contract with Extendicare. Will there be any penalty for that?
Yeah, sure.
So first of all, I want to be clear, Arthur, is that the taking over, the purchase of the land and the facilities is not something that the SHA or the government of Saskatchewan can mandate. That is 100% up to Extendicare. And what happens with those facilities and how they move into the next phase of their operation within the province of Saskatchewan is part of the transition process that we just don't know the answer to your questions right now. So if, as an example, we were going to purchase the land and facilities and Extendicare wanted us to do that, we would have to enter into negotiation to determine the cost. Don't have any idea at this point in time, Arthur, what those numbers would look like. But that is certainly part of the transition process. It's not just the ongoing collaboration on clinical care and directing staff and ensuring residents receive safe, high-quality care. There's the other frame of it is what does happen with the facilities, what happens with the land, where does Extendicare want to go with that?
Thank you. Does anyone else have any follow-up? Lisa?
Further to that, I guess, do you have any idea how much it's going to cost to run these facilities every year into the future? Like, what is this going to add to the cost for the province?
Off the top of my head, no, we do not know. We haven't. That's fairly, we're fairly early into this and determining, what this means. Lots of decisions to be made in the months ahead. Bottom line is, though, that we're making sure that the residents receive the best possible care they can, and that's the message here today, that we want to ensure that residents and their families have confidence that regardless of where they might be living in terms of being in a long-term care facility in Saskatchewan, that they are receiving top quality care and that they are safe and being looked after. And we've heard us talk today about continuous improvement and always trying to make things better. And we see that in any number of the new facilities we've built in this province, and even specific to the new project here in Regina, the 600 beds. The fact that 250 of those they'll be a specialized beds, because we're dealing with as people age, some very complex healthcare issues. There's no one size fits all approach to this. So no, we don't know what the cost will be, but at the end of the day, this is about making sure that we provide the best possible care we can for seniors and older adults in Saskatchewan.
How many long-term care, oh, sorry, go ahead.
Sorry, I was just going to add to that question just very briefly is the additional cost will be determined based on what happens primarily with the facilities and the land, because the cost of resident care is already being paid for in the province of Saskatchewan in supplements. So that would be the same as what we would receive for funding as we run any of the other SHA facilities, or like our affiliates. The fees that they would receive from residents or on behalf of residents would already be I won't say it's a sunk cost, but it's already something that's going to continue. These people are going to continue to require care, and that's an expenditure that's already happening. So it's what are the ongoing costs of facility and lease, and is it a buy outright or is it something else? And so exactly as today, we run facilities, and there's a cost to running those facilities, like any facility, and that would be an incremental cost. But until we go through the transition, we won't know that.
Any changes to, for example, staff costs or maybe equipment costs to get them to conform to SHA standards, or what union costs?
It wouldn't be any different than you would see in a change in any other owned facility with respect to preventative maintenance on an ongoing basis and collective agreement driven wage costs, etc.
Vicki? Yeah, how many long-term care residents have died in Saskatchewan as a result of COVID-19 since the pandemic began?
I don't know that number, but we can see if we can get that for you. I don't know.
Well, I don't know. We'll track it down for you. Yeah.
I don't know.
I have one follow-up as well. I was wondering, will the contract with Extendicare just expire, or is the SHA breaking it early in some way? And will that mean that you incur any kind of financial penalty?
Sorry, Arthur. So we have informed Extendicare that we want the agreement that we currently have to end, and within that agreement there are terms for how long it can take to negotiate that out on both sides. I have had direct conversations with the president of Extendicare Canada, as had Sharon and Dr. Shadhansia, our team on the ground, with respect for our desire for that to happen quicker. And as I've said before, and Sharon has touched on this as well, Extendicare has collaborated and cooperated and worked with us side by side, including the desire to have a seamless transfer as possible, as quickly as possible.
But if you were to do that quickly, I mean, is it written into the contract that you would need to incur some kind of penalty? Okay. And just one quick clarification. There's been different numbers used in terms of the number of deaths that have been connected to this outbreak. You said 42, and I knew that was a number that we had used earlier, but I thought it was subsequently corrected to 39 after a few deaths were found to not be related to COVID. I'm just wondering if you can be one number that you have absolute certainty on.
I can't off the top of my head, Arthur, but certainly I'll have the team follow up directly with you on, and everyone else, so you're aware of what the number is. But it's the number I have is 42.
Any other follow-up?
I have a question. This morning, the Health Minister, Paul Merriman, suggested that it's easier to ship critically ill patients out of province than to bring in healthcare workers. Do you agree, and what are your thoughts on that?
I do agree, and within certain limits. If there was a specific specialty that was abundantly available outside the province and folks were not experiencing the same COVID pandemic that we were and were willing to send us people, that would help. But as we learned when Manitoba approached Saskatchewan, as you recall, in May and April of this year, we took transfers from Manitoba when they experienced their highest peak. the first call to us was, can we have staff come to Manitoba? And our preference, which I believe is the preference of many jurisdictions, is not to send their own teams outside of province. Again, depending upon what they experience. We're all experiencing this pandemic at different stages. But I do agree with those comments from the minister that overall, from a true overall critical care capacity, with the number of staff that's required to staff a bed over a 24-hour period, yes, it doesn't make sense to bring those teams into the province. It makes a lot more sense to send people out at a very last resort if we have to do that.
Follow up? Doctors have said that increases the probability of death, though, in serious illnesses. Is that a concern, or is it still easier? Or is easier the preferred option?
I'm not a clinician, and I'm not sure where your source is, but we do have a team of physicians that are responsible for making these decisions, a small group that will triage patients that would be appropriate for transport. Any movement of any patients in a critical phase would have an increased risk associated with caring for that patient, but I would also point out that air ambulance teams across this province and across this country are highly trained and are intensive care trained to deal with these transfers. So absolutely, again, it's not an ideal process, but again, if we can't provide the level of care in province, the standard of care that we've talked about for the last weeks, we feel it's better to send people out of province so that they can have that care provided to them by another jurisdiction.
The source, by the way, was the Deputy Medical Health Officer at the last SHA physicians meeting.
Okay.
Thank you. We have time for one more question if anyone has an additional. Lisa?
In the Ombudsman's report, there was a lot of stuff about Extendicare, but there were at least a few references to problems within the SHA, like people that Extendicare was dealing with who either had incorrect information or didn't know the information that they needed or didn't enforce it. What's being done within the SHA to fix that problem?
Sharon, did you hear that question?
I did hear it, thank you. There was 4 recommendations to the SHA in the Ombudsman's report as well, and we are working diligently on all of those recommendations as well. We accepted them and are working to improve our processes. So through the co-management, we have teams on the ground working daily with or weekly with each of the facilities to be sure that we are clear about the standards of care and what the requests are. So we've taken to heart the information in the Ombudsman's report and the recommendations. We're taking them seriously and making improvements on our side as well. Thank you.
Thank you. That concludes our time for today. Thank you, everyone.